Rogers TV.
Hello and welcome to this special edition Rogers TV program dedicated to COVID-19 and informing you of the services and resources available to you and to your family. For those of you who watch the program regularly, you know I like to say a few words of thanks right at the beginning, and I do try and change it up a little bit so it's interesting to you. So I want to express my thanks to the community for their support throughout this COVID-19. But as we move into phase 2 of the reopening of our province, I want to encourage everyone to celebrate the new opportunities we have, mindful of the guidance that's still in place. And hot off the press today, there is a news release from Grey Bruce's top doctor. And I gather that's the phrase now for our medical officer of health, Dr. Ian Era, Grey Bruce's top doctor, who is recommending wearing face coverings. So this news release actually came out today, June 11th. And based on the advice that we're given, of course, social distancing is still critical, or physical distancing is probably for most of us to feel comfortable with these days. So during all of our day-to-day activities, we still have to have the physical distancing. And groups of up to 10, Friday, June the 12th, will be allowed. However, Dr. Ian Era is strongly recommending face coverings for everyone to decrease the risk of COVID-19 when personal distancing is not possible. Certainly with retail employees wearing cloth masks or other non-medical face coverings, but also those of us who go to the retail settings. He is encouraging us to consider wearing cloth masks or other non-medical face coverings. The reason for this is when worn properly, masks or face coverings can reduce the spread of infectious respiratory droplets and prevent many of your germs from leaving your mouth and your nose. And this is especially important when physical distancing is not possible. We all want to keep the physical distance, but sometimes when we're doing grocery shopping or other retail shopping, it's not always possible. So wearing a cloth mask or other non-medical face covering is an additional measure and not a substitute for physical distancing and hand washing. So the good news is we are getting there. There is more to do. A huge thank you to all in our community who continue to provide support for all of us, to the medical officer of health and the staff at the public health unit, our essential and community support services, vendors who are continuing to reinvent themselves and their businesses. Thank you for your hard work. We will get through this together and stronger than ever, and we do look forward to seeing more of each other. And on that note, I am delighted to welcome back Ian Reich, who is a health unit manager. And the topic we're going to be covering today, because he did such a great job on the masks and how to wear and don and off masks, we're going to be talking about the do's and don'ts of hand washing. Because people may assume they know, oh yeah, I know how to wash my hands, but there is quite the science to it. Ian, thank you for joining us today. And I'm wondering if you can, I know your portfolio keeps changing a lot, and I'm wondering if you can tell me what's in your portfolio and what you're responsible for right now at the health unit.
Absolutely. So thank you very much for inviting me again to the show. So my portfolio right now is I am public health manager for our population health department, but also our harm reduction and sexual health department. So quite a wide variety of topics, but population health, you can think of how are we keeping the population safe? So every single strategy that can potentially keep people safe and understand the risks that are out there. And then harm reduction is really focused on keeping those people that do use drugs as safe as possible, using techniques like having naloxone on hand or using safe injection equipment, that sort of thing. And then, of course, sexual health is to keep to treat people that do have a sexual health related illness, but also to prevent those illnesses from happening, as well as talking about how to prevent pregnancy and how to be safe during pregnancy as well.
So that's quite a mixed portfolio you're carrying for sure. And I'm sure you've seen some changes as a result of COVID-19 in the emphasis that you're placing around community health. We're getting news releases. How are you managing through all of this?
This is a 100-year event, so there's not a single person in the workforce that's gone through this anywhere in the world. We're talking 1918 was the last time we've seen something like this. So in terms of how we're managing, I think wonderfully, especially here in Grey Bruce. 0 deaths throughout all of Grey Bruce as a result of COVID, and only 1 hospitalization since the absolute beginning. So I think as a health unit as a whole, we're doing great. In terms of what I'm doing, I'm trying to, I am, me and Drew Ferguson here at the health unit are leading our communications team. So things like the website and social media, those media releases that you see, we're helping out organize and develop all that content, obviously with a wonderful team that we are working with, and big shout out to them because nothing would be possible without them.
Excellent. Yeah, and that is so true. One of the things as we start to reopen, I'm hearing concerns from a variety of people. Well, are people just going to disregard the precautions and just, they're tired of being isolated, they're tired of the physical distancing. What advice can you give to people as we move towards reopening?
Sure. So reopening in and of itself, all of us are really feeling a sense of we want to go out, we want to be part of the community again. And today really is a time of positive caution, I guess you can say, not forgetting all the messages that we have learned to date. As we reopen, more and more and more people are coming out into the stores and into the public. As a result, with more people, there's more germs. And as a result, the potential risk for exposure to those germs is definitely higher. We are also starting to see more and more people come from the cities, as they always do year after year, to come to their cottages that they own, but also to come to those short-term rentals for a weekend or for a week. So we really, at this point in time, it is a time of caution and a time that everything we've learned can't be forgotten, and perhaps probably more important than ever to prevent what we're sort of anticipating as a potential second wave, as they say. So these precautions that we're talking about are definitely just as, if not more important now than they have been previously.
And you couldn't have given me a better lead-in to hand washing. So let's talk about the do's and don'ts, how to dispel some of them, the myths or misunderstandings around hand washing. So I'm going to turn it over to you because I know you've got some fancy camera work that you can use. But what would you say to the public about hand washing techniques?
Sure. Hand washing in general, we've been taught it since kindergarten, even before then. Hand washing is by far and away the most important thing that we can do as people from the public, in our households, at our workplace, to prevent infection. It's been proven time and time and time again. And ever since sort of germs were understood, hand washing was the most significant tool used to prevent infection. I bring us back to the Civil War time, World War I. More people during those wars died not because of their actual injuries, but because of the infections they had post-injury. And the result of that was because we just didn't know about germs. Once we found out about germs and started washing our hands and started making sure we used sterile equipment, those infections disappeared. And then we got antibiotics, another bonus for preventing those infections from happening, as well as vaccines and clean water. Those 4 initiatives by themselves are hugely important, but hand washing definitely has prevented so many deaths and infections throughout the world. I can't hit home hard enough about how important and yet how how many times we tend to miss it. I'm guilty of it. Everyone is. It's a hard one to meet perfectly, but I think what we'll talk about will really help people understand that it is quite simple, and let's make it as simple as possible to be as effective as possible. So the better you wash your hands, the less germs are on your hands, the less germs you're perhaps sharing with other people as well.
I know that in some in-services that I've attended, they've actually demonstrated what's left after hand washing by using a substance on your hands. Can you speak a little bit about that and the commonly missed areas? Because honestly, I was shocked. I thought I'd done an amazing job in hand washing, and then the truth came out and I had missed some areas. So that was incredibly eye-opening for me.
Yeah, most definitely. So we do have a tool. Typically, we use it with, in the schools or at health fairs, just to demonstrate exactly what you mentioned about how easy is it to miss parts of your hands when you're washing. So what a glow germ is, that's the tool we use. Basically, you put some fluorescent invisible dye on your hands. So that dye, it's basically, when you put a black light to it, it shines really, really bright. So you put that dye on your hands, you go and you wash your hands. You try to do the best job that you possibly can. You come back and you put your hands under that black light, and it will shine on any piece of skin that maybe you didn't wash very well and has some of that dye left on it. What you'll find, almost guaranteed, is the areas in between the nails here, the cuticles, very, very common to see that dye shine bright right in the cuticle area. Another area you'll typically see it is around the jewelry that people wear. So rings, bracelets, that sort of thing are very common. And if you have really dry, cracked skin, in those cracks, you'll definitely see the dye really sticks there. And it just goes to tell you that when you think you may be doing a really good job, you may not. I've done it. Other people have done it as well. And it really hits home and lets you realize how important it is to actually do hand washing properly.
So on that note, I'm wondering if you can walk and talk us through and maybe splash us through a little bit of hand washing so that we really see the proper technique. So now you are on display.
All right, perfect. So just give me 1 second here. I'll try and get the camera to focus properly here.
Yeah. So anyone who's motion sick, close your eyes for a minute.
All right, how does that look for you?
That's good. That's good. I know the producer will text me if he needs anything changed. So.
All right, perfect. So excuse my body, and definitely you will hear some noise when I turn the taps on. So the wonderful thing about working in a place that provides healthcare is we have a wonderful setup here. We have some automatic soap up here, as well as our paper towels on the wall. So obviously, if you're in your home, you're going to have more of a hand pump or a bar of soap that you may have, and you probably don't have paper towels, even though they are definitely the most recommended when washing your hands. And we'll get into that once we get to that point. So really, I don't know if you can see, we also have an instruction of how to hand wash over top of every single one of our sinks to make sure that we just don't forget. It's very easy to go pretty quick through this hand washing. So very much, the first step is try to get some warm water going. Warm water is really important because it helps sort of loosen those oils that might be on your hands and helps the soap out, sort of remove the particles from your hands. So I'll just turn the sink on. You're going to get some loud noise there, but bear with me and I will just demonstrate sort of how I typically would wash my hands. I'm going to show how I would wash my hands if I'm at home or out in public, that sort of thing, not necessarily before I'm doing some sort of procedure in a healthcare setting. There's not many differences, but there definitely can be. So bear with me. So warm water, really important. So you want to wet your hands a little bit. Add a good amount of soap. And what you want to do is lather that soap up for at least 15 seconds. Imagine you're washing a pan that has just got a whole bunch of burnt cheese all over it. you want to get rid of that burnt cheese before you use the pan again. Same thing with your hands. Get rid of all the germs you possibly can. You want to hit every single surface and rub quite vigorously. It's the friction and the removal of the germs that you're trying to do. Most soaps don't kill germs, so you really want to get them off. And if you see, I'm going for quite a long period of time. We haven't even reached 20 seconds yet. 20 seconds is the recommended time for hand washing. When you're done, you notice I've hit every section, paid attention to my rings, and in between my fingers and my nails. Really important. You want to point your hands down, rinse that soap off. Now, most people will go to shut the tap off right now. You got to remember, you turn the tap on with dirty hands, so those taps are dirty. Don't touch them yet. Grab your paper towel, 1, 2, however many you need to dry your hands off properly. Pat them dry. This is still a tool for you. Don't throw it out yet. This is what you use to turn off your taps. Now, most of us would throw it out right now. Your best bet with this, keep it until you get to the door. Open the door with it, crumple it up at that point after the door's open, and then you can throw it in the garbage. You just don't want to touch things with your brand new clean hands until you absolutely have to. So now you have some clean hands. You can go eat. You can assume that they're as clean as you can possibly make them. And that's it.
Excellent. So now we've swung back. That was excellent. There's a few things that I noticed, and so maybe we can emphasize. You were quite specific about needing to get between the fingers, and also you made a point of getting where we would call it the web space where the thumb is and up along the thumb, because all of those points are contact points for sure. But I also noticed that when you were letting the water come off you, you put your arms down into the sink.
Yeah.
Can you explain a little more about why?
Sure, it's a habit. So very first class when I took nursing in university was how to properly wash your hands. And I was taught definitely to let the water run down your hands for general hand cleaning. And the reason for that is you don't want sort of stuff to dribble down into your elbows and whatnot, because what you'll do more than likely when you have to dry them, you're going to dry your arms and potentially pull that dirt up back into your hands. So it's a potential recontamination strategy that we definitely use. You'll notice though, when people are doing surgery, they actually wash their hands for not just 20 or 30 seconds. They're doing minutes and minutes of hand wash with special brushes and whatnot. And they wash all the way up to their arms. And they will rinse their hands like this and let the water run down. But then they have someone with sterile towels drying them off and putting sterile gloves over top. So it's a very different process.
Yeah, so it's really important, though, to recognize that it is better to keep your hands down into the sink, and if you have to get a little bit of the excess, to let it drip down into the sink so that, like you say, you're not recontaminating the area. So let's say I'm out in a store and I use the facilities, but I don't know how long 20 seconds is. Or do you have any strategies around what I need to do to be sure I'm done the washing as long as I need to?
Sure. So easiest strategy is count. It's also pretty boring. You can add a Mississippi in there to make sure it's a full second, or reference yourself to a song or a tune or a chorus that you know based on singing it before lasts between 15 and 20 seconds. A good one, if you sing it at regular speed, is the alphabet. Probably the easiest go-to song to sing that will last for about 15 or 20 seconds at the very least. If you sing it pretty slow with a good tune, you can last 30 seconds.
Yeah, so definitely using something like that as a trigger, because it is amazing how long you really need to be washing those hands. Once I started to do that kind of thing in my head, I mean, didn't always sing out loud, but it's amazing how long it takes. But it was an education for me to know that I had to do it that long. So I found that really helpful. And that for a parent to teach a child how long, they could pick their whatever song they like to sing to themselves as well.
100%. Kids are wonderful to teach hand washing to. I've done it quite a few times, and let them choose the song and put a time to it. If they sing the song in 5 seconds, tell them to sing it 4 times. Make it fun, make it enjoyable, but also teach the reasons why. So using pictures and images of what germs are and how they're on the hands, that sort of thing. Use as many strategies that kids enjoy to make sure that they understand the importance of hand washing, because the good habits start when you're a child, not when you're an adult. When you're an adult, we have to break them.
Yeah, agreed. So you mentioned bar soap and push dispensers, and then of course the automatic dispensers. Is there one that you, for a general household, that you think might be a better approach?
Absolutely. So bar soaps definitely are not recommended. After you use them, they sit there and they sit moist, usually pretty warm. And what happens is, even though they are soap, unless they're antimicrobial, and even if they are, you'll still get some germs that multiply. And the ones that aren't, you'll get a lot of germs. So the first time you pick it up, you're washing your hands with it, they can be quite contaminated. So really for home use, what's recommended is one of those hand pump dispensers, but you don't need to buy the antibacterial soap. Again, really the important thing when you're using soap and water to wash your hands, you're removing things. You're not killing things. You're actually trying to get them off of your hand and down the drain.
Yeah, and that's an important difference, actually, is that concept. So certainly, there's many products out there, and I'm not necessarily asking you to name one or the other, but the idea is it doesn't always have to be an antibacterial soap. The idea is more about getting it off the surface and the scrubbing action. That's really, really important. Now, as far as shaking hands or using air dryers versus towels, because often in the public washrooms, you have a choice. Is there one that you would suggest?
Paper towels, far and away, are probably the easiest option to use. You definitely don't want to go to a public setting, and I hope you won't find any, but they used to have those pull down actual fabric towels that basically just wound through the machine, and they're definitely not recommended. Paper towels are wonderful. If there's an air dryer, they're wonderful as well. You just have to be careful about them. I've seen some where you have to fit your hands very carefully down the middle of them, and you're bumping into the sides of them. Every time you're bumping in, you're putting germs on your brand new clean hands. So if you do use one of those hair dryers, or hand dryers, sorry, you definitely want to pay attention to not touch your hands to any of the surfaces. Only let the air flow. If you do turn them on, some of them are push buttons still. I like using just my elbow to turn those ones on. Most of them are automatic now, which is wonderful. Put your hands under them. Just try not to touch the wall behind or the actual air dryer itself.
Yeah. And how long should people stay under the dryer? Because sometimes, people are impatient to get back shopping. Is there a magic time that you think that they need to?
The time is totally dependent, unfortunately, on how forceful the dryer can dry your hands. You really want to make sure that your hands are dry before you start leaving, because the very first thing I know that I do if my hands are still wet, I rub them on my pants to dry them off, or I put them in my hoodie pocket or something like that. So you're defeating the purpose. If you have wet hands, you're really more at risk of potentially contaminating. So you really want to keep them under the dryer until they're dry.
Yeah. Now, what I'm hearing from people is either hand washing is preferred, but hand sanitizer you can also use. But their skin breaks down and they have irritation sometimes, because especially with the hand sanitizer, there's a certain percentage of alcohol base, correct? Can you mention the percentage This
Sure.
is
So most products that you'll find in the store are between 60 to 75% alcohol. And basically what that means is 70% of the bottle is alcohol. The rest is other stuff. What that other stuff is special oils or emollients that they mix in to make it as gentle as possible to your hands. And they've done lots and lots of research on the hand sanitizer. So just as an example, in healthcare settings, if you were to compare people's hands that wash their hands as often as they use alcohol hand sanitizer, the people that use the soap and water, their hands are actually in worse shape than the people that use the sanitizer in between. And that's because those protective emollients really do help protect the hands. But with excessive use of anything on the hands, you will potentially get some irritation.
Yeah. Is there anything safe or recommended for people who are getting the irritation? Because sometimes that becomes a deterrent for them using more, especially if you get a sting when you're using the sanitizer. Is there anything you can suggest that is safe for people to use and doesn't, again, defeat the purpose?
Really, if the sanitizer is very, hurtful or abrasive to any open wounds or cuts like that, the soap and water really is your best bet for the hand hygiene piece. But then using a really good moisturizing cream or protective barrier cream is really, really important. Obviously, there's a ton of products out there, but any high quality hand cream that provides sort of that intensive moisture will give you as much protection as possible for sure.
So there's no reason why after you've washed your hands or used the hand sanitizer that you can't use a moisturizer.
Exactly. It really depends on the setting. So obviously in a healthcare setting, you don't want to go from washing your hands to grabbing a bottle and recontaminating your hands. But for general use, absolutely. As long as the products are kept clean, you can apply some hand lotion to your hands after you wash your hands.
Excellent. We have 1 minute left in the program, Ian. Any last words of wisdom to us?
Just for folks that do use the hand sanitizer, there's rules to doing that as well. So I'll be really quick. Basically, you want something about the size of a dime when you put it on your hands here. And you really want to rub quite forcefully. And you want to pay attention to your nails. So rub your nails into that area there. And that's really to try and get that sanitizer into your nails, in between your fingers, and you want to do this rubbing until there's nothing left. Once you've done that, your hands are virtually just as clean as would be with soap and water, but you've killed the germs. You haven't taken them off. So you've got a whole bunch of dead things on your hands, but they won't hurt you.
Ian, on that note, I want to thank you so much for this. This has been excellent. And thank you to our viewing audience for joining us here. Please join us again. Take care, stay safe, care for each other. Thank you, Ian.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Are you the type who would keep going or stop? It's not easy to stop when you have an addiction. Legalizing cannabis won't stop addiction. It trivializes its consumption. Let's be vigilant. If you need help, visit portage.ca.